A second person who contracted has died, health officials said. The death in the U.S. comes amid increasing concerns about the safety of e-cigarettes and the long-term effects on health. The unnamed person was said to have fallen ill after trying a product bought at a dispensary for recreational cannabis. They were rushed to hospital in the state of Oregon and put on a ventilator after quickly becoming very ill. Local health official Ann Thomas said it was unclear whether the victim's illness was caused by contaminants, ingredients in the liquid or the vaping device itself. The death happened in July, but details have just been released. Another death was announced last month in the state of Illinois. The fatalities come amid an outbreak of lung disease across the U.S. that officials have linked to vaping or the use of e-cigarettes. Some 200 adults and teenagers have contracted respiratory illnesses and infectious diseases have been ruled out. Several of the cases involve vaping THC, the main active compound in cannabis. Experts from the U.S. Centers for Disease Control Prevention, CDC, said. There is a black market for THC-containing vape cartridges, and users in online communities have been warned of the dangers of unregulated fakes. The American Vaping Association has blamed the illnesses on illegal vape pens containing THC. However, experts have cautioned against thinking that any kind of vaping is completely safe. Dr. Brian King from the CDC's Office on Smoking and Health warned, "We do know that e-cigarettes do not emit a harmless aerosol. There's a variety of harmful ingredients identified, including things like ultrafine particulates, heavy metals like lead and cancer-causing chemicals," he added. Electronic cigarettes have been described as a less dangerous alternative to regular cigarettes, and Public Health England maintained they are a highly effective tool to help people quit smoking. However, academics in the UK have said much more research is needed and there needs to be better regulation. There are concerns about the amount of young people taking up vaping because the products still contain highly addictive nicotine. Some vaping products have also been found to contain other potentially harmful substances, and a number of the flavors, such as cinnamon, vanilla and cherry, produce a toxic reaction. The UK is currently bound by EU regulations on the amount of nicotine in an e-cigarette, and the levels in the US are much higher. Dr. Aaron Scott, from the University of Birmingham, said this could account for the higher number of health problems so far in the US. He recently published a paper showing that vaporized e-liquid fluid has a similar effect on the lungs and body as seen in regular smokers. According to this research, vaping is cytotoxic and pro-inflammatory. He told metro.co.uk that there needed to be more long-term studies and better regulation before it could be promoted as a better alternative to traditional cigarettes. Research shows around 5% of the British public use e-cigarettes, but researchers say they believe the real figure is much higher. Vaping products are not safe for children, young adults or pregnant women, but they are still freely available to buy in shops. At least 2 people have previously died in the U.S. after their e-cigarette exploded in their face.